Picture this. A curious student sits on a dorm room bed after a long day, brain buzzing with questions about why the body sometimes feels electric, and why one touch can turn a normal moment into something charged. That spark, that is not magic. It is a conversation between your brain, your blood, your skin, and the tiny chemistry lab inside you. Sexual arousal begins in the head. A thought, a memory, a sight, a smell, any of those can flip a switch in the brain. The limbic system, a lineage of old brain structures, reads the signal and sends messages to the body. Nerves light up, heart and breathing speed up. Blood flows differently in the pelvis. Vessels relax and widen, bringing warmth and swelling to genital tissue. Glands release moisture, muscles may tense, skin can flush. All of these are honest. Biological responses, none are moral. Just mechanics. The more attention and safety you feel, the louder these signals get. Context matters. A quiet, trusted place amplifies curiosity. Stress turns the volume down. Now imagine the body after that curiosity is satisfied. Or simply as part of daily care. Good genital hygiene is not glamorous, but it keeps that body conversation pleasant and healthy. Start with what experts agree on. Use warm water and your hands for people with a vulva. Clean the external parts, the labia majora, labia minora, clitoral hood, and perineal area, gently. Do not shove soap inside the vagina. The vagina cleans itself with a delicate microbiome and balanced pH. For people with a penis, wash the shaft and grin. If you have a foreskin, gently retract it, only if it moves easily, and rinse underneath. Then, return it. Never force retract. Mild, unscented soap can be used on external skin if desired. Strong soaps, douches, scented wipes, and antiseptics often do more harm than good by disrupting natural flora and causing dryness or irritation. Be mindful around the anus. Clean the area externally with water and gentleness, and dry by patting. After sex, a warm rinse and clean hands can reduce the risk of infection. Dry off fully to prevent moisture buildup. Change out of damp clothing promptly. If you use products, choose those labeled hypoallergenic and fragrance-free. And listen to your body. Persistent itching, burning, a new colored discharge, sores, or pain are signals to see a health professional. Here's a small experiment for your curiosity. Next time you shower, pay attention to temperature, pressure, and how different spots on your skin respond. Notice the flush, the pulse, the small differences between cold and warm water. These observations link the science of arousal to everyday hygiene. They show you how care, attention, and respect for your body tune the system, increasing comfort, decreasing infection risk, and preserving the sensitive balance that allows you to feel pleasure safely. Curiosity is your best lab partner. Ask questions, read reputable sources, and if something feels off, seek a clinician who talks plainly and without judgment. Your body is both an interesting subject and a trusted neighbor. Treat it with curiosity, care, and clear practical skill.